Loosen it up if you need to, nice and tall. And last one. Good work. So last one with the band, seated tall, lead with
Health Unit here to provide you with a COVID-19 update for Simcoe Muskoka. So as of today, we've had a total of 17,931 confirmed cases, up by 1,081 cases over the past week. And that is the largest increase we've had in a single week throughout the entirety of the pandemic. We've today had an increase of 197 cases, and that is the largest increase we've had in a single day. Our case count has actually increased by just over 50% compared with a week ago. And over the week of December 12th onward, we've had 852 cases compared with the week of December the 5th to the 11th, when we had 564 cases. And so that's up to 141 cases per 100,000 population per week. And by my recollection, the highest peak of incidents that we had earlier in the pandemic was at the height of the third wave at about 120 cases per 100,000 population per week. So quite substantially higher than we've ever had the incidents before. And the highest number of cases that we had in a single week earlier in the pandemic during wave 3 was 716 cases. So 716 cases compared with 852 over the week of December the 12th. There's been a 55% increase in the case count in Simcoe County over the past week, as opposed to a 14% increase in the case count in Muskoka. So a higher rise in Simcoe County compared with Muskoka. And the province also more than doubled its incidence over the past week, up by 109%, and having an incidence of 127 cases per 100,000 population per week, up from 61 the week before. Children under the age of 12 make up 19% of the cases we had in the past week. Excuse me. And so far in December, we've had 2,216 confirmed cases compared with 1,652 cases in November. We presently have 1,495 active cases, and this includes 31 cases in hospital, 8 in the intensive care unit. And our reproduction number is also elevated at 1.6 compared with 1.3 the week before. So anything above 1 means that the pandemic is growing in our district. During the week of December the 12th to the 18th, 59% of our cases had 2 or more vaccinations, so fully vaccinated with 2 or more doses. So this is the first time the majority of our cases in the preceding week were fully vaccinated. I think that's an important point to note because we are going through essentially a transition with dominance of Omicron as the new variant in the past week compared with in the past. And we do know from the emerging research that there's a very high breakthrough rate of infection among those who've had 2 doses of vaccine from Omicron as a variant. It is protective in the range of about 30% for the prevention of transmission of becoming a case. So much less protection with 2 doses for Omicron versus the previous variants such as Delta. There's still, by the research, a significant amount of protection against hospitalization. So important that people note that, but the real takeaway message is how important it is now to get a booster dose where the range of protection against infection is between 60 and 80%, so quite a bit better than for 2-dose immunization. So the fact that we're now seeing the majority of our cases in the last week being among those who are fully vaccinated really speaks to the fact that everybody needs a 3rd dose. 2 doses alone aren't going to protect sufficiently. But we have had some breakthrough cases among people who are 3-dose vaccinated as well. So a total of 16 cases. And what I'm going to be doing going forward in time is monitoring and reporting on the percent of those who've had a booster with breakthrough cases, and also the degree of protection and vaccine effectiveness of 3-dose immunization in Simcoe Muskoka with the Omicron variant. I don't have those figures for you today, but we will have them going forward in time. That's now really a key indicator for people. Our percent positivity is elevated at 6.8%, and that's the highest percent positivity that we've ever had. Percent positivity is the percent of our tests that come back as positive. And going forward in time, we may find that we're not able to test people sufficiently, that people's ability to access testing becomes compromised by the sheer number of cases that we will have in this district or have in the province. And so monitoring case counts alone won't be complete, and we'd also be needing to look at the percent positivity. So the percent positivity will go up higher if we're not able to test enough people, and that would be an important indicator. And it's also an indicator of just how much transmission is happening. The fact that it's elevated suggests both that there's a much higher degree of transmission happening, and also people's access to testing is not as good as it had been before when it was lower. We have presently 31 people from Simcoe Muskoka hospitalized with COVID-19, which is up from 24 the week before. And we have 8 in the intensive care unit, up from 5 the week before. I certainly am going to be noting hospitalization and ICU figures for Simcoe Muskoka as we report to the community. According to the Science Tables report that they issued last Thursday, we expect not only a high rise in cases, but also an elevation in hospitalizations and ICU admissions, particularly towards the end of this month going into January. So that's important information for us to be monitoring. Among those who are hospitalized, 65% had no record of vaccination, so they were not vaccinated. 9 were fully vaccinated, 2 were partially vaccinated. And 4 of those hospitalized had a booster dose. So breakthrough cases with a booster dose. We actually have incomplete information about the variant type of these individuals. So one has been found to have the marker for Omicron, the S gene target failure, awaiting confirmatory testing with whole genome sequencing. And there's some others that are outstanding with regards to this kind of testing to determine the variant. And a number of them have been shown to be Delta. So there is a lag in time between the onset of someone as a case and them deteriorating to the point that they become hospitalized. And so what we're looking right now, I think, with regards to those who are hospitalized is that they are reflective of the Delta cases that were occurring before the onset of Omicron, as well as at least one of them being part of the Omicron outbreak, the Omicron wave. We've had 2 additional deaths over the past week, and I would like to express my condolences to the family members for your loss. And they consist of a woman in her 80s from Simcoe County and a man between the ages of 45 and 64 from Simcoe County, both of them unvaccinated. And therefore, we've had a total of 286 deaths from COVID-19 to date in Simcoe, Muskoka. We have had multiple outbreaks, many of them occurring in venues with children under the age of 12 or between the age of 5 and 11. So only fairly recently able to become immunized. But we know now with Omicron that 1 or 2 doses isn't going to be effective in preventing transmission for the most part. And there's no indication about eligibility for booster doses for those under the age of 18 at this time. So we've had 48 outbreaks, which is unchanged for the past week. And 73% of those, or 35 of them, have involved populations that were only recently eligible for vaccination. So 31 elementary school outbreaks, 1 private school, 3 childcare centers. And we've also had some outbreaks in vulnerable settings, such as congregate settings or facilities that provide services or care for the elderly or for those with medical conditions. So 1 shelter, 2 long-term care facilities, being Trillium Manor and Bob Rumble House, and 2 retirement homes, the Warrington Retirement Lodge and Berryview Retirement Home, and 1 hospice and 2 group homes are in outbreak. We've had 5 secondary schools in outbreak, 2 of them with 10 cases each. And 1 of our elementary schools has actually got a mix of both Delta and Omicron cases. So we've had some other locations that have 8 locations with outbreaks with high attack rates. So more than 10% of the occupants are affected as cases. And they consist of a shelter in Simcoe County, group home in Simcoe County, a child care center in Simcoe County, Trillium Woods School in Barrie, Warrington Retirement Lodge in Clearview, a hospice in Muskoka, a group home in Simcoe County, and a Forest Hill Elementary School in Barrie. I've been making comparisons with regards to the other health units in the Greater Toronto Area because through the fall with the 4th wave, we were standing out as being in surge when they were not. However, with this transition into a wave with Omicron, that is changing and essentially becomes no longer relevant. The other health units around us have rates now that are in the same range as ourselves or even higher. So Toronto has 141 cases per 100,000 population, Halton 172 cases per 100,000 population, as opposed to our 140 cases per 100,000 population per week. And so going forward in time, this comparison with other GTA health units becomes less relevant. And I would also point out that Kingston has a very, very high incidence of cases as well, over 400 cases per 100,000 population per week as the health unit with the highest incidence. They had a very large outbreak among students from the Omicron variant that took place very rapidly. One thing that I need people to understand is that our capacity to keep up with the full number of cases that are surging with Omicron is very, very limited. And this is actually true happening throughout the province now as we experience this new Omicron wave, that all health units are going to be very limited in their ability to follow up on all cases. And in fact, we'll have to prioritize the cases that they do follow up. We do have assistance from a provincial workforce as well. And so they'll be following most of our cases. We're going to be following the cases that involve congregate settings and healthcare settings, long-term care facilities, group homes, retirement homes, and the other cases will be followed by the provincial workforce. In all instances, we'll be taking less data in our history taking associated with these cases. And in many instances, cases will be asked to follow up with your own contacts to advise them that they too should go into quarantine. And we do have on our website information about exactly what they need to give in the way of information when people who are cases do that. But as our case counts continue to rise, if it does in fact follow the trajectory that is anticipated with the science table report, there'll be an increasing number of cases for which people will have difficulty accessing testing in the first place, or even if they do obtain testing, would not be reached by either the provincial workforce or local public health. And so it's very important that we all take upon ourselves the responsibility to identify if we may be a case, if we have symptoms, or if we've had contact with a case or a possible case, and put ourselves into isolation for 10 days after the onset of symptoms or 10 days after the last contact with the case in question, if you're in contact with a case. And this is regardless of whether or not you are reached, whether or not you are tested. It's really important that people take that upon themselves to help limit further spread. So one of the complications of all of this is we will have a reduced level of information about our cases, about the venues that they've been in, where they may have obtained their infection. And we would be less likely to be able to report on outbreaks. We've been quite limited with regards to that over the past month or so, but it'll become more limited. We'll become unable to report on other exposure sites. So the ability that I can provide now to talk about other exposure sites will become diminished over time. And we'll have to concentrate more and more on the severe cases, reporting on severity, and on the vulnerable settings, the congregate settings, and healthcare settings. So we can still, though, report what we have. And so one thing I would say is that we've had between December 12th and 18th, 29 community exposures reporting more than one case. This is actually down from the 40 that I reported a week ago, but noting that the caveat that our ability to get the information that we would need to identify all of these places is becoming more and more diminished. So we've had exposure sites that are related to hockey, to multi-unit dwellings, to recreational centers and sporting centers, to workplaces, multi-unit dwellings, food premises. And the most common locations are actually gyms and recreational facilities, multi-unit dwellings, food premises, and office settings. Other locations of note would be construction sites, places of worship, in addition to the locations that I've already cited. So it's important for people to be aware that this is transmitting readily, that this is a much more transmissible version of COVID-19, that people need to really take the precautions to heart. And there have been exposures in many community sites that it's possible to get exposed and get infected in many, many community locations. We have certain data about our known or suspected Omicron cases. So far, we've had 34 of our COVID cases that have been found to be Omicron by whole genome sequencing, and another 208 that probably are Omicron because of the S gene target failure, a screening test. And in those cases, we await confirmation with whole genome sequencing. And some things of note is that these people are younger. They're all below the age of 60, that a significant number of them are associated with school outbreaks, that there's more of them in Simcoe County than in the District of Muskoka, that 68% of them have had 2-dose or more vaccine failure. So the pattern here is younger people in a variety of settings, including settings with young people, and a high rate of vaccine failure for 2 doses. One thing we also note is that we've had a transition in the percent of our cases that were due to Omicron over the 2 weeks ago as opposed to last week. So 2 weeks ago, 41% of our cases were Omicron or suspected Omicron. And in the current, I should say a week ago, 41% were suspected or confirmed Omicron cases. In the current week to date, 72% of our cases have been found to be suspected Omicron cases with the S gene target failure. So shift to the majority of our cases now are coming back as Omicron cases, and we will soon have, I think, complete dominance of our cases as being Omicron. The province has had more than 1,000 confirmed Omicron cases to date, with more than 200 in the last week, and over 8,000 S gene target failures or suspect Omicron cases, with over 2,000 of these in the past week. So, we're continuing with immunization, and with the commencement of booster vaccination, we are ramping up again to the level of vaccination provision that we were at really at the height of our spring and summer campaign. So at that point, we were up to 1,000 cases a day. Yesterday, we were just over 1,000 individuals vaccinated. And the majorities are for the boosters. So we continue provision of vaccine for children, first and second doses for others, the last mile strategy. Otherwise are proceeding now very much with the booster doses, as is in keeping with the provincial campaign. And this will take us many weeks, well into the new year, to complete that campaign. Currently, we have over 78,000 booster appointments that are booked. And the capacity this week is almost full. 85% of our spots are full for the next week, and greater than 90% bookings for all the weeks in January. So, high uptake in demand at this time. We've also achieved 37% first dose vaccination of our children 5 to 11 years of age, in keeping with the province's coverage rate of 38%. So essentially the same as what the province has achieved. Okay, and our monitoring dashboard is in red status, and I think will be for the duration of our present wave. with viral spread being in the red category due to very high rates of transmission. Laboratory testing still actually in a red status with regards to the percent positivity, but otherwise a good turnaround time for test results. Health system capacity overall is in yellow due to a high acute bed occupancy, but not a high occupancy for ICU admissions. And the public health system is in red category due to our reduced ability to get to confirmed cases within 1 day at 52.8%, our target being 90%. Okay. First off, I would like to commend the province for their decision in putting in place as of Sunday reduced occupancy limits for businesses and public venues to 50%, as well as a variety of other restrictions that are needed to reduce transmission in those settings, and also reduced gathering limits in private settings to 10 people indoors and 25 people outdoors. And so this is clearly important on the part of the province. Something that I was certainly seeking would take place. I had announced a week ago that I would be proceeding with issuing a letter of instruction if the province didn't proceed with this kind of action. I would like to commend the province for having proceeded with this necessary action. With regards to vaccination, with regards to booster provision, in keeping with province's direction, we are providing booster vaccination for those who are 18 plus. And people can certainly book vaccination in our clinics through the provincial booking system, and you can go to our website in order to make a connection to that. And as it indicated, we've ramped up vaccination to the rate that we'd had before in the spring and the summer. We continue to note that there are certain priority groups who are at higher risk and therefore really need access to vaccination sooner, third dose. They are those who are 50 plus, healthcare workers, the Indigenous population and their non-Indigenous household members. Here I'm talking about adults, and anyone who had received 2 doses of AstraZeneca vaccine for their primary series. And so we are seeking to accommodate such individuals for walk-ins at our clinics where space allows, as a way of assisting them in receiving vaccination. We also note that the province shortened the interval from the second dose. Formerly, it had been 168 days, and now it's 84 days, so just under 3 months. And certainly I encourage all people to obtain your booster dose as quickly as you can manage. There are other venues that you can use as well, such as community pharmacies and in some instances primary care, or maybe in some healthcare settings providing for their healthcare workers. I note that we have surpassed the 1 million vaccination dose mark. And this happens to coincide with our 1-year anniversary of commencing COVID-19 vaccination in Simcoe and Muskoka. So I want to congratulate everybody involved in that. Specifically, we provided 1,036,000 doses of COVID-19, and this has been done through all venues over the year. So the very first venue to start was at 29 Sperling Drive, operated by RVH with as well partnership from the Simcoe Muskoka District Health Unit. And that has been the longest standing and continues to be in place, and has provided a very large portion of the volume of vaccine that we've provided throughout the pandemic. So really want to thank and commend RVH and the city of Barrie, who also provided the site for that particular contribution. But To get to 1 million, that really required all hands on deck. It required us to have our mass immunization clinics, community clinics in the spring and summer, and then again now our multiple community clinics that we have going again, a number of them at school sites, and required the support, participation of municipalities with regards to those sites and the provision of much more in the way of assistance as well as hospital participation, primary care, community pharmacies, community pharmacists, in some instances participating directly in immunization in their clinics or in their pharmacies, paramedic services, and hundreds of volunteers. So I want to commend everybody involved in achieving the milestone of 1 million vaccinations and having been with us for a year. Congratulations to all, and thank you to all. And this is going to go on for a long time yet. So I continue to feel gratitude for all who've helped us with this. The school boards as well with regards to school sites. So thank you to all. Going forward, we may very well find there's some employers as well that are participating in this. So I want to commend everybody, every agency that's been involved. There's a Go Back bus as well that provides mobile vaccination, and that would be the province participating in that, the Red Cross and others. I hate to leave anybody out. There's just so many parties that need to be cited for this. With regards to testing capacity, I've already spoken to the potential for a difficulty for people to access testing as we see a great increase in transmission of the number of cases. So certainly people should do what they can to get tested if they develop symptoms and access tests that they can access. So there are the assessment centers. There's been some take-home test kits provided through schools, and we will continue to do so in the new year to help keep our schools running, our primary schools in particular. Employers, in a number of instances, for many months have been able to obtain through the Chambers of Commerce test kits. And in some communities in the province, there have been pop-up test kit provision that the province has organized. And so people would have a number of opportunities to be able to get tested. But I do note that as we continue to have a rapid rise in transmission, that the ability for people to be able to access these things is going to become increasingly difficult. So that takes us back to get tested if you can, if you're symptomatic or if you've had a high-risk contact, or if there are other reasons why you need to do so, such as attending long-term care facilities or other healthcare settings as required. But first and foremost, if you develop symptoms or if you've had a contact with a possible case, you need to isolate and avoid transmission to others, and advise others that you've been in contact with that they too should be considering and determining whether or not they need to be isolating for a 10-day period after the onset of symptoms or after the last contact with a high-risk case, a high-risk contact. Really, really key. I've also spoken to the challenge that we have increasingly over time with regards to getting to people who are cases and their contacts. And so that takes us right back to we'll do our best, or the provincial workforce will do its best to get to people, but you need to take upon yourself responsibility for isolation if you're a possible case or a contact. We are adjusting some figures on our Health Stats website with regards to vaccination coverage rates to align with Public Health Ontario's changes in their approach. And so the age of vaccination is now being defined as the age in which a person was vaccinated, not their present age. And those who have deceased in the interim are been removed from the calculation. So this can have a subtle change. The most noticeable change will be those vaccinated between the ages of 12 and 17 will have their coverage drop by 4%. So there'll be an explanatory note on our website with regards to that. So going into the holiday season, it's really important that people note that we can have capacity limits. They're down to 10 people, and requirements for reducing risk in public settings, and the requirement for mask use and physical distancing, but in your own home, in social settings, you really need to take upon yourself the protection of yourself and others. And there's really now, I think, an importance to realizing that Omicron is much more transmissible, much more readily transmissible than the previous versions of COVID-19. And that 2-dose vaccination does not provide sufficient protection against transmission. People need a 3rd dose. So there's a kind of a hierarchy approach to safety with regards to gatherings. So sticking to your household and otherwise remote contact with people or outdoor contact with people would be the safest means of doing so. If you are having people in your home, have a small group of people in your home, certainly people need to self-screen if they have symptoms and not attend. Certainly if they're contact with a case, they need to be isolating. As I'd said, you really need to keep a very small group of people and note their degree of risk. Vaccination status is important, but really 3 doses is needed to avoid transmission. So opting for use of masks and distancing helps to reduce the risk, and something for you to consider in your risk assessment of the gatherings that you would be participating in. We do have information on our website to help further with this kind of thinking and preparation for yourselves. So there was a question on social media about mask use, sufficiency of mask, and Public Health Ontario last week had put out an updated interim set of recommendations about mask uses in healthcare settings and in public settings. So I think the question would really be about public settings. There are directives from the Chief Medical Officer of Health about what's required in healthcare settings, and that information is being promoted in those settings. But with regards to the community, we still have a few principles in mind that are really important. First, you need a mask. If you're in an indoor public setting, that is required. Even outdoors, if you cannot physically distance 2 meters from people. And it's certainly something to consider in your home setting if you're having people over, particularly people of higher risk, or if you're at a higher risk of a severe outcome of COVID-19. But the quality of the mask is important, and such a mask should be over the nose, like above the nose and mouth, and fitting well without allowing space for airflow, and should be at least 2 layered, maybe 3 layered, and a medical mask would be more protective than a cloth mask. And according to Public Health Ontario, a non-fit tested respirator like an N95 mask or a KN95 mask is also an option that would be safer for people to use, provided that you're wearing it properly. So really important for people to be aware of that, and that information is available on the Public Health Ontario website. So at this point, I would be happy to take questions.
Thank you so much for your update today, Dr. Gardner. We will now take some questions from the media. As always, we do ask that those participating limit themselves to 1 question and 1 follow-up in consideration of time. Can we start with Erica Engel from Collingwood Today? Do you have a question?
Yes, thank you. Dr. Gardner, you mentioned rapid testing and third dose boosters, but for a large portion of the population that I'm hearing from, we can't find rapid tests, and booster dose appointments are a couple months away now for us. So I think there's like a segment that's nervous because of Omicron and because this is the advice that's being given, but we can't really follow it. So what would you say there?
I recognize fully the challenge of this situation, and certainly encourage people to continue to look for book access vaccination, noting that when you're dealing with a total population for Simpcom Muskoka of 600,000 people, it will take many weeks for us to be able to work through and provide vaccination to that many people. So we're fully committed to work as expeditiously as we can in a sustainable manner, akin to what we did with the spring and summer campaign. But unfortunately, it takes time to be able to do that. And I've already acknowledged that access to testing is going to become increasingly compromised as case counts elevate going forward. So people really need get the vaccine when you can. If you develop symptoms, get tested if you can, but you really need to isolate if you develop symptoms, if you're a contact of a possible case. And you need to take upon yourself to do all the other precautions to the very best of your ability. The physical distancing and mask use, good quality mask, really reduce your social circle at this time. And practice hand sanitization and self-monitoring. And I would just go back to it's very worrisome, and I can certainly see and acknowledge the concerns that people have at this time.
Okay, and just in follow-up to that, in listening this past couple of weeks to health professionals like yourself, like Dr. Brown and Dr. Moore, the talks have taken on sort of a different, maybe more bleak tone. Like we're using terms like blunt the wave instead of stop the wave. And it's really feeling like this is taking off no matter what we do. So, 2 years in and we're into this sort of bleak January ahead. What do you think about that? It's
tough. There's no doubt about it. It's a tough situation. The projections from the science table were very worrisome. The one projection they had that involved some degree of control to buy us time for vaccination required a 50% reduction in contacts between people, social contacts. That's very, very hard to achieve. I'm very glad that the province put in place the control measures they did, but that might not achieve that degree of reduction of contact. And we need to see whether the degree to which it actually blunts transmission. So I am very concerned about the situation.
Thank you.
You're welcome.
Chris Simon from the Barrie Advance, do you have a question today?
As always. Hi, Dr. Gardner.
Hello. Hi, Chris.
Hi. And happy holidays to you, by the way.
You too.
Where we are right now, is this a failure of the public health system or of government? Like, it just seems like we have taken some real steps back in where we are in the pandemic at the moment.
We've taken major steps back. I think it's important to note where we still have strength. So having the great majority of the population with 2 doses of vaccine is important. It puts people within a range of getting that 3rd dose they need, and it still provides probably in the range of 70% protection against hospital admission. So that's important, but it's not the level of protection we had before with Delta. So it's a major step back. The fact that we have these projections and now the experience of rapid transmission and the beginning of a rise in hospitalizations is very worrisome. I'm not sure about blame, right? About failure, so to speak. We're up against a powerful natural force of nature adversary, this virus that has this ability to transmit so readily and mutate in the direction that it has to become ever more transmissible. Previous versions more virulent or severe. We don't yet know just how severe or virulent this particular strain is at this time, but we're up against a very powerful adversary, and it's taken the world's resources to struggle with it, and still we're in this situation.
Yeah, I mean, I guess locally, one of the areas where I see that there has been a bit of a gap is with things like enforcement, though, and I'm referring to a video that I've seen of a church in Barrie that was just under outbreak, was the largest outbreak in the region, and they've reopened, and they've got members that are walking around without masks on video. It just seems like there are no consequences for organizations and businesses that flaunt the rules. How do you respond to that?
Well, we've always been very compromised in our ability to do enforcement. We can only respond when we get complaints. Otherwise, it's messaging tools, information tools to businesses and venues to comply. You tell me about this particular church location and its video. For us to know about this is important. I appreciate that. But we don't have the resources to proactively do that kind of monitoring. When we know of something, we can follow up and respond. And we have issued tickets and fines and orders before. And we do take our progressive discipline, or progressive enforcement, I should say, approach with educate and then enforce and then fine. Because that's the normal way that we do things, and most of the time that works. And I would say that the level of success that we've had is because most comply, most take it to heart and comply, and we're left with those who do not. So I acknowledge we're challenged. We're very challenged about enforcement. We have to also use other enforcement agencies who are also empowered to act, like city bylaw officers, ministry officials, and even police in partnership with them to enforce. But they too have their limits as well. We really rely on people to bring to our attention issues like what you've just raised.
And sorry, would you not say, though, that it is going to be next to impossible when you have organizations like this, flaunting the rules, to ever get the pandemic under control locally?
We have such a communicable variant that even with very good compliance, you're going to get some transmission. When you have poor compliance, then the risk goes up that much more indeed. But even under the best of circumstances, we have a really tough adversary. It's going to take a while before we get this managed, and many people are going to become infected.
Thank you.
You're welcome.
Can we go with Martin Halick from Vista Radio? You have a question?
Yes. Hello. Can you hear me?
Yes.
Hi, Dr. Gardner. So when you mentioned the booking system for booster doses, you mentioned that appointments for those doses are largely booked into January. Are there any plans to add additional booster clinics to help manage the rollout?
Indeed, we will continue to book out into the future. We need to be assured of what are the venues that we would have in place going beyond January. So that has to be established before we would post those bookings for people.
And one follow-up, are there any plans for maybe temporary measures, temporary pop-up clinics, that kind of thing?
Pop-up clinics are certainly helpful, and in particular for vulnerable populations that can't get to our clinics otherwise. But at this point, I think we're using all the personnel that we have in the most efficient way to reach large numbers, and that's with the large community clinics.
Thank you very much. Happy holidays.
You too.
Mary Beth Hartle from Muskoka Region, do you have a question this afternoon? Okay, Mary Beth, maybe I'll come back to you. James Bowler from Cogeco, do you have a question this afternoon?
Yeah, thank you very much. Dr. Gardner, first of all, I just want to ask you, you kind of addressed this, but I want to clarify that the spread we're seeing right now, and we're over 100 in Muskoka now for active cases, is this still dominantly or predominantly the Delta variant? And when could we start seeing a shift into a full-blown Omicron variant spread?
So it's now dominant Omicron. Like the cases occurring in the past week have been over 70% Omicron. And according to Public Health Ontario's analysis report that came out last week, probably 90% of the transmission that was happening at that point, live time, would be due to Omicron.
Okay. And just wanted to ask about booster shots. I'm curious as to the reasoning behind the health unit prioritizing still just 50 plus for walk-ins. The goal here is to get everyone vaccinated. The 50 plus population has had a good chunk of time between the time that the 18 plus eligibility was put in place and when they were allowed to get in and get these vaccinations, to get them booked in. I'm just curious about that prioritization still. Should we not be just trying to focus on the entire population now?
Well, older people are much more likely to have severe disease and die from COVID-19, and we presume the same of Omicron. And we still have a brisk uptake among those that are 50 plus interested in receiving immunization. We will have a greater impact on health if we can give them a means of prioritization, even if it's a very limited means, such as walk-in ability. Once we find that demand falls off, we can move to younger populations to offer that option.
Thank you for your time and happy holidays.
You too. Thank you.
Mark Claremont from Muskoka Today, do you have a question?
Yes, thank you very much. My question today is regarding your decision to limit your own health unit resources in the contact tracing and asking people to, for example, a person like me, if I tested positive, to tell my surrounding community that I tested positive. Do you think that people will actually do that, admit that they are testing positive?
We have our full resources deployed to this. So this is not limiting per se. It is focusing the resources that we have to where they're needed the most, and using the provincial workforce otherwise for the other cases. And they too have taken to this method. This is used across the province now of having asking cases to follow up with their contacts. And in most instances, we are hopeful that they will do that. If they encounter a situation where they refuse, then we would look at the potential to do that outreach ourselves to the best of our ability, noting that we've got our limited resources.
Yeah, that's good. Logical. Over the holidays, the next couple of weeks, and you said that it's likely to peak around New Year's and that sort of thing. What are your health unit resources able to do over that holiday time? Will it be so-called business as usual for everybody?
So first, I think it's important to know that it won't peak in early January. It will continue to rise through January. We don't know exactly when it will peak, but it won't be the beginning of January. During the holiday season, we are continuing case and contact management Monday through Friday, and vaccination every day of the week, with the exception of Christmas Day, Boxing Day, and January the 1st. Our staff are pushed to the very limit, many of them doing much in the way of overtime hours in order to help us be able to do that. But we are seeking to allow them at least a little bit of restoration to avoid burnout of our workforce.
Great. Thanks very much. We'll see you in, I guess, next week, right?
If needed, I will be available next week. Yes. What I would point out is we've also identified a large number of pharmacies that are available to provide vaccination on December 25th, 26th, and January the 1st.
Well, okay. Thank you very much. That's to you.
You're welcome.
Can we go over to the phone line this afternoon? Do we have any questions from the phone? Okay, I'll take that as a no.
Oh, yep. Sorry, I have
Hi,
too many
Adrienne.
buttons to push. Hi.
Hi, welcome.
Thank you. Hi, Dr. Gardner. My question is, there doesn't seem to be an end in sight to this pandemic. The virus, it keeps mutating, and people are told to keep getting more vaccinations. People are still getting sick. Do you see an end to this? And if you do, what does that look like?
Well, nothing lasts forever, but the ability to see to the end of this is not clear to me. I don't know when or exactly how it will end. We put a lot of faith in vaccination, and we're very, very disappointed with Omicron and the degree to which it's undermined effectiveness of vaccine. We still have quite a bit of benefit from a third dose, so that is a good thing. And we certainly have the ability to develop new vaccines, but the course of the pandemic has been discouraging, to say the least. And I don't actually have a clear vision as to exactly when and how it will end.
As far as Omicron goes, I understand it also has.
I'm sorry, but your volume is very low.
Oh, is it?
There we go. That's better.
Okay. As far as the symptoms for this new variant, are they vastly different from other ones?
Essentially the same, more in the way of nasal congestion. Back pain has been another identified feature, but essentially it's the same sort of presentation. And some in the media have identified maybe it's milder, but we don't know exactly how severe it is. The data is a little too soon. And the picture that's emerging in some European countries, such as Denmark, really is consistent with it being of a similar severity compared with the Delta variant.
Thank you. Have a good day.
You're welcome.
Can we go back to Mary Beth Hartle? Do you have a question? Okay. Was there anyone who did not have the opportunity to ask their question this afternoon?
Hi, Kara.
Hi, Mark.
Might I just ask for clarification to Dr. Gardner regarding the positivity? I think you said 6.8%. Is that the highest that's been throughout the entire pandemic?
It's the highest that we've seen in Simcoe Muskoka. I believe that there's been some rates elsewhere, such as Peel, that's had higher in the previous waves.
Okay, thank you very much.
You're welcome.
Well, I believe that brings us to the end of our media briefing this afternoon. Dr. Gardner, again, thank you so much for your update, and thank you so much to the members of the media who participated this afternoon. As Dr. Gardner mentioned, we do have a media briefing tentatively planned for next Wednesday. Thank you so much, everyone.
Goodbye, everybody.
Recording stopped.
I was going to say best of the season. It's okay.
A beautiful sight, we're happy tonight, walking in a winter wonderland. Gone away is the bluebird, here to stay is a new bird. She sings a love song as we go along, walking in a winter wonderland. In the meadow we can build a snowman and pretend that he is Parson Brown. He'll say, are you married? We'll say, no, man. But you can do the job when you're in town. Later on, we'll conspire as we dream by the fire to face unafraid the plans that we made. Walking in a winter wonderland, just walking in a winter wonderland.
Last Christmas I gave you my heart, but the very next day you gave it away. This year, to save me from tears, I'll give it to someone special. Last Christmas I gave you my heart, but the very next day you gave it away. This year, to save me from tears, I'll give it to someone special. Once bitten and twice shy, I keep my distance, but you still catch my eye. Tell me, baby, do you recognize me? Well, it's been a year, it doesn't surprise me. Merry Christmas, I wrapped it up and sent it with a note saying I loved you, I meant it. Now I know what a fool I've been, but if you kiss me now, I know you'd fool me again. Last Christmas I gave you my heart, but the very next day you gave it away. This year, to save me from tears, I'll give it to someone special. Oh, last Christmas I gave you my heart, but the very next day you gave it away. This year, to save me from tears, I'll give it to someone special. Crowded room and friends with tired eyes, I'm hiding from you and your soul of eyes. My God, I thought you were someone to rely on. Me, I guess I was a shoulder to cry on, and face on a lover with the fire in his heart, a man but you tore me apart. Yeah. Now I found a real love, you'll never fool me again. Last Christmas I gave you my heart, but the very next day you gave it away. This year, just save me from tears, I'll give it to someone special. Oh, last Christmas I gave you my heart, but the very next day you gave it away. I'll give it to someone special. You know I'll give it to someone special.
Sing me Noel, 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 sing me Noel, Noel. Filled with laughter, filled with cheer, Christmas time is coming. Sing me Noel, 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 sing me Noel, Noel. Out in the air so crisp and clear, Christmas time is coming. When the warmest winter night, Christmas time is coming. Underneath the stars so bright, Christmas time is coming. To the village we will go, Christmas time is coming. Over the fields and through the snow, Christmas time is coming. Noel, 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 Noel. Sing we Noel, 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 sing Noel. Merrily, merrily now we sing, Christmas time is coming. Sing we Noel, 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 sing Noel. Hark the church bells, hear them ring, Christmas time is coming. Noel, 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 sing we Noel, sing we Noel.
little Christmas right this very minute. Candles in the window, carols at the spinet. Yes, we need a